Bonjour tout le monde. Hello, everybody. Welcome to today's online presentation, panel discussion, providing sustainable and trustworthy information to newcomers. Now, before we begin our webinar today, we'd like to begin with an acknowledgement that N4 is hosted at CHIO. CHIO is located in Ottawa, Ontario, and Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions across this land. My name is Andrew Tomeyer. I'm the education coordinator with N4. I use the pronouns he, him, and I'll be hosting and moderating today's panel discussion. My co-host is Colleen Drake, who will be monitoring our Q&A box today. I'm pleased to introduce you to today's panelists. Panelists, I will ask that you turn on your camera as I introduce you. Our first panelist is Sean Scher. Sean Scher is the Director of About Kids Health and Digital Learning, who joined Sick Kids in 2013 after years in the private sector, delivering digital online experiences for some of Canada's largest corporations. As Director of About Kids Health and Digital Learning Solutions at Sick Kids, he leads a multifunctional team in the production and promotion of online patient and family education, digital-based health solutions, and digital learning opportunities for staff. Sean is an active leader within Sick Kids community, serving on the Education Council, the Child and Youth Steering Committee of the Medical Psychiatry Alliance, engaging patients and families in research work in the Research Working Group, Performance Management Steering Committee, Virtual Care Steering Committee, Patient and Family Advisory Experience Committee, and the Staff Continuing Professional Development Fund. Fazul Rahim is Communication Manager with the Newcomer Info Hub at Refugee 613. He's a former journalist and communications expert with well over 2 decades of professional experience. As a reporter and country bureau chief for CBS News, and later NBC News, he covered Afghanistan news, writing features and investigative stories, and co-producing television pieces for various platforms of the networks. He also brings over 5 years of work experience with UNDP Afghanistan as a communications officer and acting head of communications and partnerships. Fazul has a master's degree in internal relations from Afghanistan Institute for Higher Education, and a bachelor's degree in political science and public administration from the American University of Afghanistan. He moved to Canada in September 2021 after the fall of Afghanistan to the Taliban, and has lived in Ottawa with his family for the past 1.5 years. Welcome. Dr. Regine Rajendran is Developmental Pediatrics Fellow at Holland Bloorview Kids Rehabilitation Hospital and as part of the University of Toronto. He's completed his medical degree and general pediatrics residency at the University of Toronto and the Hospital for Sick Children, respectively. He did his Master's of Science at the Institute of Medical Science. He's the lead of Tamil Kids Health, one of 10 chapters of Our Kids Health, and member of the steering committee for the project overall. Welcome, panelists. Now, today's session is being recorded and will be uploaded to our N4 platform. We'll share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. And as well, before we begin today's event, I would like to take a moment to introduce you to the platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. Some of you might have the same question or be interested in a particular response, so today you also have the option to upvote questions. Please upvote questions you're interested in hearing the answer to, and we will prioritize which questions we would pose to our panelists first. Now, our speakers today have no conflicts of interest to declare. So with that said, let's jump right into today's discussion. We're going to start with 2 initial questions and then follow it up with a portion of our panel discussion with our Q&A from the audience, and then wrap things up with one final takeaway question for you today. Now, welcome panelists, one and all. And so to begin, let's start with our first question. Our first question and our questions today will explore the ways in which resources are developed and how data is collated into the information that we and our clients, newcomers, receive today. So with our first question, let's begin with Sean. What is your organization's process in determining which metrics, infographics, and resources to develop and disseminate for the newcomer communities that you serve?
Thanks, Andrew. And thank you for having me here today. I think one of the ways to best describe how we make our content decisions is to first just kind of describe exactly what our service is, because it really does speak to how we create and how we make those decisions on content. So as you mentioned, About Kids Health is an online health education resource here at Sick Kids. And each year we have about 20 million visitors to the website from every country in the world. We have users nationally and locally here in Toronto. But each of them consistently give us a 91% visitor satisfaction rating. And one of the reasons they do that is because we have thousands of child health topics that we've created, but also we've created them in plain language. We've made them accessible in multiple languages, and we have supplemented those topics and articles with rich media, whether it be images, videos, things like that when required. But most of all, it's because it's trusted. All of our content and all of our material is written and provided by the health professionals here at Sick Kids. So our local mandate to collaborate is to collaborate with our healthcare providers at the Hospital for Sick Children to produce those important health education resources that equip hospital staff, patients, and caregivers with the information they need along that journey of patient care. Whether that's preventative and healthy living at home, or it could be research before a health care visit. It could be during a visit at a hospital here at Sick Kids, at another hospital, at your community pediatrician, or it could be referencing material after a visit with their healthcare provider. So what really drives those content decisions for us is we're here to create that material in partnership with the medical expertise at Sick Kids, but these are the topics and resources that they need us to create, which in a sense is the needs of our frontline staff, which really reflects the needs of our patients and families that they're serving. So it could be an important update or a new article to help our emergency room staff better explain something to patients and families, or a common health topic, but in a language more suitable for our current patient census. But About Kids Health's approach to create those materials, which act as that assistive tool for our care providers, and do it in a format which helps them explain things to families. We may also, there may be a decision to create much larger resources or multiple topics, which can help families transition to home care, and can be used as a reference for them if they've had a particular complex procedure or complex illness in the hospital, how to better care for their child at home. There are some occasions where we'll work with Sick Kids Communications and Public Affairs, and that's where we may create more community-based and community outreach-based material and topics and articles to help answer the questions that parents have out in the community. Yeah, that could be seasonally relevant content like summer safety tips, respiratory virus infection season, which we all know very well. And of course, the pandemic vaccination related resources during COVID-19 that we created to help Toronto Public Health, many of our community health partners, but we did that in lockstep with our Sick Kids Communications team. And then there is the odd occasion where we will self-direct some content planning. Most of the time, that's when we want to go out and actually maintain and update a lot of our content that may have been up for a year or two, and we want to ensure that it's still relevant.
Excellent. That's great how Sick Kids, the staff at Sick Kids can help leverage the information that's being developed and help build the knowledge translation to the communities that you serve, which is great and it's excellent. And speaking of developing information regarding the pandemic, one of the excellent resources as well was those that were developed at Refugee 613. So I will pass the question over to Fazul.
Thank you very much, Andrew, and hello and good afternoon to everybody in this webinar. It is good to be here with you. To your question, Andrew, just if I may quickly give a quick background of Refugee 613, and then we'll come to the question. Refugee 613 initially started as an organization in response to the influx of refugees back in 2015 from Syria. It started as a local initiative at the Ottawa level to welcome and facilitate the refugees from Syria. But then over the years, it evolved into a sort of communications and information hub for the newcomers and immigrants and refugees, not just for Ottawa, although we still are, we still have that carry that 613, which is the Ottawa area code with us, but we are literally, we serve refugee communities across the country, nationally. It's not just for Ottawa. So that's what we precisely do in the sector. Probably we are among the very few organizations that are only thing, we don't provide frontline services to the newcomers, but we try to provide the information that the newcomers and refugees need in the format that they could understand easily with plain language, and get it through the platforms and channels that that can reach to them. In terms of the process of creating resources, we have a very vigorous process of how we decide on a particular resource for on a topic for the communities. The first and most for us is at the center of it is the community and the newcomers needs themselves. So we assess their needs in based on the need, we decide on a topic and then we decide to produce a content, a resource for it, and then also based on their information habits in the with the platforms they use, then we decide what sort of which format the content would be and what kind of platform to use to reach that content to the newcomers. And we do this assessment through various means and ways. One is that we conduct audience surveys where we go to the communities, we pick a sample size and ask about their information needs and the sort of topics that they need the most, and also their information habits. Perhaps we just concluded an online survey in April, and we got some good interesting data from it that. For example, if I may go on the topics that of the interest was employment, followed by healthcare information, followed by employment, healthcare, education, and then other topics. So once we I mean that's one way. Then we also have our listening channels. One listening channel, our own direct listening channel that we operate is we have this digital messaging for settlement integration. We call it the MSI, where we run a Telegram group for the refugees from Afghanistan. and where we have now over 750 members. In the group is moderated every day, Monday to Friday, and any member of the group can post a question there. Even they can record in their voices if they cannot type, and somebody would respond to them in the language that they ask. No, the group is moderated in 3 languages: English, Pashto, and Dari. And that is where we clicked all that, the questions, and we build on the trends of the questions that we see. I mean, we respond to that, the specific question for the specific individuals, but then we record them, and then based on the trends, and we see that there is a lot of interest in one particular topic, then we turn that particular question of a few particular person into a resource, and then decide on the format of it. Normally, we do use various formats. We try to make it as simple as possible. Plain language is at the top of our at the top there, in the use of infographics, and then recently we also have started using short videos in multiple languages. We then translate all those that resource into multiple languages. We have about 26 languages. Not all resources are translated into 26 languages, but normally the average is between 10 to 15 languages we translate, and that depends on the need, and that depends on the need of the time. For example, if we have an influx of refugees from a particular region, then we make sure that the languages that are spoken in that region that are included in our resources are translated into those languages. And then the platforms we use. Sorry, just to add this, we are informed by our surveys in audience research what sort of digital habits the newcomers have in particular communities, and so we use that in design content that are particular for that kind of format. For example, all these online platforms or these social media platforms. So we try to use as much as possible the digital means, but we also go to the traditional means, and we provide our information package also to the service providers who are directly working with the refugees and newcomers and immigrants. So they also use those resources and distribute and disseminate among the newcomers.
Oh, that's excellent. And so not only are you developing resources in multiple different languages, you're being able to understand where newcomers are accessing their information, as well as providing that resource to through the Telegram groups, for example, to not just share the resources, but also build upon what you've provided to help clarify any questions that may come up, which is excellent. And so with that, I'm going to pass the question now over to Regine.
Thanks so much, and it's a pleasure to be here as well. And I think you'll probably notice there's some common themes between all 3 of our organizations around collaboration and addressing needs of our respective communities that we serve. Specifically with Our Kids Health, our aim really is to provide accessible, culturally relevant parenting resources to support parents and their children, particularly in BIPOC communities. And our organization really was born during the height of the pandemic, when our founder, Dr. Ripu Minhas, recognized the need in the Punjabi community, and started developing short videos, short clips through our various social media platforms, TikTok, Facebook, Instagram, etc. And realizing that it was having quite significant success in terms of reaching that respective community, we eventually expanded to 10 total communities now, consisting of Punjabi, Tamil, which I'm the lead of, Arabic, Cantonese, Mandarin, Filipino, Black, Hispanic, Ukrainian, and Inuit. And this was identified through a national study of where the priorities were. And really our goal with all of this is to improve the overall wellness in these communities by empowering parents, improving parenting competence, for example, reducing stress, creating supportive virtual parenting communities. And we hope to do this by sharing culturally relevant evidence-based parenting resources. So in terms of determining, which resources and infographics that we might be developing or disseminating through our platform, we really pride ourselves in being a community-led organization. So the community's input significantly influences the kind of resources and infographics we develop. As I mentioned, I'm of Tamil background. Our entire team for Tamil Kids Health, our members are Tamil, and either second generation or first generation Tamil from Sri Lanka or India. And they provide a lot of feedback, and we work together to provide guidance around the resources that we develop. But we do have a foundation curriculum that sort of all the chapters initially kind of follow, and it generates, it sort of guides the general direction for content, focusing on critical health and parenting topics. But the important thing that we try to do is pay close attention to what's coming in our comments and in our private direct messages, questions, really try to move our content towards generating them related to that. So eventually kind of the bulk of our content in each of these chapters are more directed by the community than our sort of core curriculum. We have like a designated You Asked Us section that we do usually weekly or bi-weekly, where we directly respond to some of these questions. And it's a live Q&A sort of thing. And this allows us to create some content that's immediately relevant and answers real-time concerns from community members. And then additionally, we also try to work closely with community organizations within our local community to identify topics of interest as well. So for example, my chapter is collaborating with some Tamil organizations in our community in and around Toronto to identify topics of interest. And then the last bit, I think that's kind of unique as well, is that we also have sort of a hot topic section. So this is when we sort of address kind of urgent things that are coming up, and similar to what Sean was talking about kids' health, things that are timely, or as I said, when this was born during pandemic, we did a lot of content related to the pandemic. This past week, we've been doing a lot of mental health related stuff. So really just trying to adapt our content to what's happening in the moment. So really to summarize, kind of, I guess our resources infographics really is community centric and community driven. And we try our best to partner with local organizations and address real-time concerns as well. But all in all, our approach is to really create culturally sensitive, evidence-based content for the communities that we serve.
Oh, that's excellent. Not only staying relevant to the topics that are at hand, but also staying relevant to the tech and the ways people are getting information as well through TikTok and various other social media platforms as well. And that's very excellent, especially since I think it was through Refugee 613 research showing that majority are getting their information from their smartphones or from places like that. So moving on to our second question. What process is required to ensure data quality or fact checking has happened from your organization before releasing information publicly? Like, for example, where COVID-19 information was coming at everybody at like lightning speed, new information was being developed throughout the pandemic. How were you able to kind of not just ensure data quality, but also go through it and then be able to organize the thoughts so that it's relevant to the information at the moment? So we'll start this question with Regine.
Sure. So at Our Kids Health, we have a process where we try to ensure the quality and accuracy of information that we disseminate. So as I mentioned previously, central to this process is a pre-made curriculum that all the chapters are following. So these are key topics that we've identified to be important around mental health, parental well-being, supporting them with caregiving. And this is kind of the foundation of our content. And this content has already been sort of extensively reviewed by experts in the respective fields, and sort of has been disseminated to each of the community chapters. And anytime we start a new chapter, they would be sort of starting off by following this curriculum. But additionally, as I said, a lot of our content is created on demand or on the fly or in more immediate, timely fashion. And so in this regard, we've developed a bit of a review board. So we have 2 independent reviewers that are experts in the field that would review any script that we make, any content that we make before it gets published. So they play a crucial role, and we're working right now to kind of put together a sort of broader peer-reviewed process it'll be a bit more involved. But being mindful that we're trying to address needs on demand and do it as quickly as possible, and trying not to add more barriers, but also making sure that all the content that we publish is evidence-based and is relevant to what the question is or what the need is. The other thing I'd say about this is that part of what we do, as I said before, was that all our content is provided in English and the language that the community speaks. So for example, the community that I lead, we have all our videos posted in English and Tamil. So part of this process is the translation piece. And so we also do have an independent reviewer who speaks the native language, and making sure that the language that's there is appropriate and is appropriate for the community itself. So that's another part of that review process, just in terms of how we communicate the content that we're delivering. And then lastly, I think I'd also say that we strongly believe in transparency and credibility. So I think, there was a question in the comments about sources. And this is something that came up when we started initially. We weren't typically doing this in terms of adding a source to our content for our content. And we, after the first few months, started adding all of our posts have like a link to like the source where we would get our information from. So that link is, as part of the social media posts that we post. So really, we want to make sure that we're ensuring, data quality and fact checking happens as part of our process. And this is a process that we're continuing to refine and develop as we learn new things. There's a lot of, part of the reason why Our Kids Health was born was because there's a lot of misinformation online through social media that's being disseminated within our specific communities, just broadly. And so one of our goals in general was to try to attack this. And so to attack this, and I think, making sure that we provide good sources and making sure our process is credible is important to us.
Excellent. No, it's very good in order to make sure that the information is good, that you go through credible sources and credible individuals checking the information that's being disseminated. So I will pass the question over to Sean.
Thank you. I think there's some real similarities to our colleagues over at Our Kids Health, mainly because I think the source of the content is very similar. At About Kids Health, all of our content is created in that essential partnership with our sick kids experts. We're so reliant on their expertise that our About Kids Health team could not create this material on our own. Our team is it's a production team. It's a team of writers and editors, medical illustrators, videographers, animators sometimes. And all of our content and medical expertise is that trusted information from the healthcare providers as the source. We'll adapt and synthesize their work to make it easier to understand, perhaps more consistent and comprehensive, and supplement it with some of the learning tools I talked about. But the typical process there will see our team receive a completed draft of a new educational material or a topic from our collaborator. It could be in one of our templates. It could be a drug A to Z, an aftercare instructions, information on a condition or disease, but it contains the medical expertise which our collaborator would have said or taught to their patients and families. That information is based on their research, on their clinical practice guidelines, their expertise on the treatment or procedure that they do every day, or their standard care instructions, which they would share with our families on a regular basis. So our team will plain language that, validate its formatting, ensure that the data is cited, and acknowledgements are in place. Although that's sometimes rare because it is coming from their practice. But mostly ensuring it follows some of the educational standards and methodology that we've learned at About Kids Health on how to prepare educational content. We may suggest adding an illustration and collaborate with our experts on that, or a video. And then there's a series of edits back and forth, each time ensuring the quality and accessibility of the content is sound, but also ensuring the accuracy of that content remains well and in a good place with our healthcare partners. We do have some final passes. Perhaps if we've been working with physicians or residents, we may go through a divisional expert on that topic, just to ensure that they're on side with the content. And also we do have one local medical editor who is a cross-appointed staff physician in general pediatrics at Sick Kids, but also works with us as our chief medical editor. And then we will move on and translate into the necessary languages and promote to the website. So yeah, so while we also need to maintain that content, so on a regular schedule, as best as we can, we will re-engage with the original authors to ensure that that work that we created is still valid. It remains accurate and is representative of their practice at that time.
Oh, that's great to hear, especially when information can change in the blink of an eye, in that you're able to go back and just make sure everything is as accurate as possible, and that the information that's available publicly is as accurate as it can be, which is excellent. And so I'm going to pass the question now over to Fazul.
Well, thank you. I mean, similar to what Sean and Dr. Ajin mentioned, we also at Refugee 613 do have a very rigid process of ensuring the quality of the data and quality of the information. With a bit of difference with the other two colleagues, because theirs is very specialized and focused on health resources, but ours is general immigration information. That also includes basic information, like nothing. We don't tell people what to do or specific health issues. It's just where to go if they need a mental health issue, or what is, like, very plain and simple, what is a mental health, or things like that. And then our focus was a lot in the past year on vaccine misinformation amongst the refugee and newcomer communities. So the process, normally we actually the majority of our content, we don't create the content ourselves. We take existing content from credible sources mainly. I mean, the first would go to government sources, and then other practitioners in any of those specific fields that we need information on. So the first we go, once we have a need from the community that, oh, there is a lot of need, there is a lot of questions on this topic. So we go out, research if there is what is out there and what is available. And if there is a good content available from credible sources that we can work on, we take that and we normally curate that to our to the community that we serve, to their need. So we curate it, summarize, turn into plain language, and then turn into a format that is easily accessible and easily readable, or easily watchable, listenable, whatever format that we produce. And if it is something, for example, the health resources, we always work either, for example, on the vaccine misinformation resources that we created a lot of them, like over 100 resources on that. We worked, the project, it was actually funded by the Public Health Agency. So we work with the Public Health Agency. So any of those resources would go through to them and would be reviewed and approved. And before we disseminate that, it would go through a rigorous process on that. And then other resources that we create on other topics, other employment or all that, we work with the relevant agencies and relevant governmental departments or relevant non-governmental organizations that are working on that field. For example, on employment, we work with Ontario Works if we produce a resource specific for Ontario, and the same with other resources. Once we produce and it goes, I mean, and then internally we have a process. We have a what do you call it, content production workflow. We have a team of mainly that's the content writers, designers, and communications experts. Once it goes through that process and the content is created, and it goes through a vigorous review process internally, and then to the external partners if we are working with an external partner, and then we have their review, and once all that is finalized, then we decide we go for translation, and our translation also goes through it makes our process a little longer. So we have normally our resources translated by professional translation agencies. We work with a few of them, a couple of them. And once we have that resource translated and sent back to us to as many languages as we ask for or as we need, then we send each of those translated language versions to a community reviewer from that respective community. We have a good network, vast network of community reviewers who have gone through a similar process of when we started selecting community reviewers, they had to meet a certain criteria, their English level and all that. So we send it to the community reviewer, A, for accuracy of translation, and B, also to make sure that it's culturally appropriate, culturally relevant, and make sure that it's just as accurate as possible. And once then we have that back, if we decide that this resource will be turned into infographic, it will go into infographic. Then the infographic will go through a review process internally, and then we send that to external partners, exactly the same as the original content. And then we send that again back to the community review to make sure it is culturally relevant, it's culturally appropriate, and it is as accurate as possible. And once we have that, then it is finalized, and then we push out through various channels, our online platforms, our massive mailing list, and then also our the organizations that we work with, the service providers who work directly with the newcomers and refugees.
Excellent, and that's great to hear that there's a content flow where there are checks and balances throughout the development of the information, checking after, not just before translation, but after translation as well, which is very important and very relevant. And it brings us into our Q&A, where one of our key questions actually is regarding feedback regarding translated pamphlets. And one attendee here says their translated pamphlets are not always accurate to their English version. how do you make sure that the content is accurate and make sure that there isn't any sort of content that's lost in translation? Literally.
Exactly. That's precisely because of, and we have had, sorry if it was also direct to other colleagues, we have had, for example, from the community, people from the community pointing out to us like, yeah, yes, you did translate, but this word, if you translate it like this, it will have another connotation, another meaning. So it's best to translate like this. Or we have been pointed out that the way this is translated is not culture appropriate. So, and we always make those fixes, and we do on the go. But so yeah, that's precisely for that, to make sure that nothing is lost in the translation. But also because a lot of the professional translators, they do, in terms of literal translation, they do a great job. It is accurate, but then the cultural appropriateness of that is another question. So that's why we have added that additional step of community review 2 times. In any of the resources, we have the community look at it before it goes to public 2 times.
Excellent.
I'll just add, I think that we sort of went through the same processes and landed on the same process in the end, in the sense of having two community reviewers, because yeah, when we initially started off, similar kinds of challenges, like one word can have multiple meanings, right? And so making sure that what's communicated is appropriate and sensitive, and making sure that we're not saying anything inappropriate. Yeah, it's important.
Yeah, if I could add, I mean, I really love the idea of the community reviewers, and I'd like to work with Regine on is there an opportunity for partnership on to get that type of quality assurance involved in our material. I do find that we sometimes have that problem even with some of our English content, where because we have so much content, we're really reliant on the feedback from our users, and if those users are local at SIPKids and they receive feedback that this isn't exactly right, or is or perhaps is culturally inappropriate, then we need to know or hear that, because it's very hard for us to know that that may exist. I hope it's in very small pockets and it's a rarity, but we do know that sometimes we'll get contacted by one of our frontline NPs that said, hey, you know what, this English page needs a slight little tweak because we've changed the way we do things now. And so we know that these things will sometimes change and require that update and maintenance going forward. Yeah.
Thank you. Thank you all for a good response with regards to that. To follow up with regards to that question, we have another attendee that asked, are there any sort of remuneration that happens when reaching out to community members for feedback to review the translations for accuracy and cultural relevance?
Yes, for Refugee 673, we do pay a small amount of honoraria for the community members who do review our content. It's not a lot. We hope that it's just to cover the time they spend on that, but it's not a huge amount. But yes, we do pay for community reviews.
And to ask Regine as well as.
Yeah, no, we currently are not. As I was saying before, our respective communities, each of our communities have, like, all our members are from the community. And so I think before we started this talk, I was saying I was asking my mom to help with translation. So we definitely try to use our resources and the people around us to check things, double check things. And we are working on, I think similar to, I guess, what Fazul had gone through, there are some services out there that help with translation that we've explored, but we did keep running into issues around sensitivity and appropriateness. So it's challenging sometimes to use some of these resources. We generally start with Google Translate. It's gotten quite good actually. But there's often lots of modifications afterwards. So our process, is currently we're not paying anyone, but yeah, it's using our community really to help with translation. Yeah.
Excellent. And one additional question from the attendee too, and thank you for these many questions. How do you choose the community members to review these materials? Do you look for any sort of like health background, healthcare background, nurses that are within the community to review any of these pamphlets or translated information?
Yeah, I can start. So with regards to ours, yeah, so there's, as I was mentioning, there's the translation piece and then there's the content, so the scientific evidence piece. Most of the time, actually, I'll give you an example. We did a post recently, or working on a post right now on behavioral challenges in autism, for example. And one of the reviewers of the content is actually a behavioral therapist who's Tamil speaking, and the question actually came from one of the family members that she had interacted with. So she's reviewing the content, so she's sort of an expert and able to speak in Tamil and translate. So that's nice when it works out that way. But then the content itself is reviewed by one of the other developmental pediatricians who is in our community, before it goes out as well. And then usually like an additional person will look at the Tamil aspect of it. So that's just to give you an example of the workflow. But yeah, that's similar, like the other communities are doing similar things. Yeah.
Thank you. So we have another question here from Edgar. It's interesting to use social media for responding to health doubts for newcomers, but sometimes there are very private information that some people don't want to share in a public forum. So how does one communicate to newcomers about safe health places where they can visit, find treatment, or receive medicine that they would need without the stigma, and be able to share that with a doctor in sort of an appropriate and private setting? And this is for all panelists.
I could start if you'd like. I think for About Kids Health in our program, we would most likely not get into a conversational type of exchange through social media. And generally our experience with social media has been much more of a push type of messaging, where we will push key topics at key times, and through your standard channels in social media, hoping that we're just bringing awareness that this information is available and guidance is available for those out in the social media community.
And if I may go, I mean, we don't provide any health services or health information specific services ourselves. That's not our mandate. But we do, as a general information for the newcomers, and we are aware of the stigma around health issues, particularly the mental health issues, and we do know that from our surveys and our we just had a bunch of focus group discussions with a group of Ukrainian refugees and a group of Haitian refugees and refugee claimants, and in all those point out that there is massive stigma around mental health issues. For example, if we won't be able to provide that kind of service, but what we do is to produce content on what is mental health issue. If you and then also even about the stigma around it, and if you need help, where to go, how to get that help. They don't have to tell that to us. They don't have to come to our Telegram group or our social media channels. They just need to know if they need that support, where to go. So we just in simple, quick, short infographics, we work with the mental health expert. We are working right now on a mental health resource with a registered clinical practitioner on an infographic on the mental health and the stigma surrounding the mental health, and what can be done, and what those who experience that, what they can do to help themselves. So it's just, for us, it's help the community to help themselves.
Thank you. Thank you. Yeah, that's very informative, very good response. And so looking at the time, I believe we can jump into our last question of the panel discussion. What is one key takeaway that our audience should understand with regards to developing and distributing helpful information to newcomers, or what should they look for when looking for resources to share with their newcomer clients? And so we'll start this question with Fazul.
I mean, the center in front for us, I think the takeaway is that the community themselves, the newcomers and refugees, should be at the center, in front of every resource, every information package, every piece of information that we use. So it should take into account their needs. What is their most pressing needs, in what is the format that they are most familiar with and easy to digest and understand, and in their own language, and so try to be as accommodating as possible to get them the information they need in their own language, with in the format that they are most familiar with, on the platform that they use the most. Be it is formal, is digital platforms, be it is it the means of just through the community settings. So it has to be the newcomers in the community. They have to be at the center, in front of any work that we do.
Excellent. So knowing what their most pressing needs are, knowing what method that they access this information in, and what language it needs to be, is very relevant and important. I will pass the question over to Regine.
Thanks, Andrew. Yeah, I mean, I think, one key takeaway from our work has been that, really the effective communication with newcomers, I think, hinges on sort of three factors that's been important to us, especially communicating through social media, which is that representation, I would say accessibility, and cultural relevance. And I talked about connecting with the community quite a bit. But one of the things we know is delivering health information or any kind of information is more likely to be accepted and taken forward, and there's and used when it's delivered by people who look like you, and it's communicated in a similar way. And so when newcomers or refugees or immigrants to our country, or people anywhere for that matter, because we do have a global audience with our platform, when they see individuals who look and sound like them, they feel more seen, heard, and understood. And actually, going back to that question before around social media and the stigma piece, I think, one of the things that we try to do as part of some of the content we deliver is provide tips on how to communicate with healthcare providers, right? So, part of this is, yes, it'd be great to have sort of a resource list, and we try to connect families that ask us questions around resources around Toronto, but we can't really speak to resources, culturally specific resources in other parts of the world. So, developing that will be, of course, helpful. And I think one of the things we're trying to do is create small community groups that are online for families so they can speak with each other and share resources. But what we really need to do is have more acceptance and more understanding and more practitioners that understand the specific nuances of treating someone who's Tamil or treating someone who's Filipino. And I think this is one of the things that we aim to do with this, as sort of like, having more content delivered by healthcare providers online through social media is not only for it's not just for the community members, but it's also for the practitioners and trying to break down some of the stigma. I think that's sort of an important point that I wanted to touch on in relation to that question. But yeah, I mean, it's similar to what Fazul said. I think accessibility is definitely an important piece as well, and making sure that our content is in both languages and it's appropriate. And the cultural relevance, as I said, I think, making sure that you can tailor your content, as I said before, to address the needs and challenges or the priorities and challenges of the community that we serve.
Thank you. Thank you. Very important to be aware of. And finally, I will pass it over to Sean.
Thank you. And I agree wholeheartedly with my colleagues' answers on that one. I probably chose a more boring or programmatic key takeaway, and it's really around sustainability. And if we look at it as a program, in a programmatic sense, it's really around that sustainability. And it's not even sustainability about how can we be around to create new content tomorrow. It's more about the sustainability of that content that you create. When we create new content, and let's say we'll dive into a new specialty, that's very exciting, and it can be very attractive to get funding for that, to create that content. But what is more of a challenge is maintaining that, is having the necessary funds, resources available to maintain that content later on. All of it has a life cycle. And as healthcare practice changes, research goes from the bench to the bedside, new care practices are introduced, so too does the content need to be updated. And that cost and need is even exacerbated when that's content that you've translated, and you spent a lot of the time adapting to multiple languages. So it's a boring one, but it's something that you need to prepare for, and it's a challenge, I think, and it's also unique to the programs, because there are different means to that sustainability, and it's not standard. There's not a standard easy answer. We're still searching for it some days, and as I'm sure my colleagues are. But that's a key takeaway, is thinking a little bit about tomorrow and how are we going to make sure these are really valuable assets and resources for our communities tomorrow.
Of course, and that's very important too, not just being able to get the information out there, get good information to them, but also it's not one simple process of we've created the information, it's there, and then that's all you need to do. You have to continuously update, you have to continuously check, and that's really relevant and important to think about. So thank you again also for that, Sean. And with that, to wrap things up for today, I very much want to thank Sean, Fazul, and Regine for being available to participate in today's discussion. It's been very informative, very relevant, and again, thank you. And thank you to the audience for the questions. Thank you for joining us and engaging with us today. You're very much welcome to join us for any of our upcoming presentations as well. And if you missed any part of today's presentation, we will be posting this to the N4 platform within the next week or so. And along with that, we do want to continue the dialogue that we've started, the discussions that we've had today. So we'll be moving any questions that we didn't get a chance to address to our online moderated discussion forum called the Meeting Place. And we've invited our panelists to respond to your questions there. Along with that, we've curated several resources related to today's presentation topic, and we will reach out to Regine after with regards to the one question on the report that he was discussing too. And you can find these as well in our resource toolkit, and we'll link them when we share the on-demand version of this discussion as well. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities. It's free. All our information there is open sourced and available to all. And we very much invite you, audience and attendees, to check it out. Along with that, following today's session, you'll be invited to complete a brief survey to share your feedback with N4. And we look at all the responses that we see and continuously improve and look at your responses with regards to new potential webinar content and opportunities that are responsive to topics that you're interested in. So we kindly ask that you take the time to complete this brief survey as well. Along with that, and I'll leave the QR code as well if you would like to check it out, we have our N4 mobile app that's available on Apple and Android devices. You can check it out through the QR code here or through going to newcomernavigation.ca/iOS or /Android to check it out. Again, thank you all. We hope that you can join us again at a future N4 event, and we hope that you stay safe, stay well, and have a good day. Take care, everybody.
Thank you.
Thank you.
Everyone.